Hi everyone, I'm Valentina from Livewell Health. I thought I'd just do a quick introduction so you can see what the face is that goes with the voice that's going to be narrating the webinar today. I've been with Livewell Health for the past 6 years, been in the industry for the last 15. Today we're going to be talking about the role of massage when it comes to oncology care. Now we'll go through a little bit of information, discuss some case studies, a few different points of research, and also some frequently asked questions that the guys in the office have sent in that you're interested to having the answers to. Some of the slides have a fair amount of information, so I would encourage you, if you want to go back and have a look at it, the video is on demand, so you can go back, pause, have a look, catch up with the information. Don't worry about trying to remember everything all in one go. Also, right at the end, I've put my email address. If anyone's got any further questions, I will happily do my best to answer them. But for now, let's get into the presentation and hopefully you get some good information to take away with you. A little bit about me. So this slide gives you an idea of what my qualifications are. One thing that I get asked a lot is, why did I go into oncology care with massage? Very long story short, I just qualified and I had a client booking who was going through oncology care. I didn't feel particularly qualified to take it on, but I had a note from her oncologist, and unfortunately at the time it was basically a case of I can't possibly do any more harm at this point, and I was released of all responsibility as far as treatment went. At the time, I felt like there could quite possibly be a lot more that I could do for this client, and I tried to book onto an oncology massage course. I was given advice by my mentor at the time to maybe get a few more years hands-on experience and then come back when I'd done a little bit more, which I did, and then eventually qualified in oncology care to be able to treat clients who are either undergoing treatment currently or have done in the past and need modified treatment on those grounds. So what is oncology massage? We basically take the foundations of traditional massage, whether that's Swedish style, sports, a few different other styles that are out there, but we have to make modifications for the treatment that someone is currently receiving or has received in the past. So modifications that we have to make will depend on if someone's receiving radiotherapy, chemotherapy, what type of chemotherapy, how is the chemotherapy being administered. There are a lot of different considerations to take into account. We'll be looking at things like the comfort of the person we're working on, the safety, if they've got IV lines in, how to position them to be the most comfortable. Also adapt pressure. That's not to say that we can't perform an effective treatment, and sometimes it can be a deep treatment, but we have to be careful where we exert the amount of pressure that we choose to. For example, radiotherapy makes the skin and the tissue underneath it very sensitive, and in some cases we would avoid that area completely and just work around that site. We also need to consider working with the client collaboratively. So we take into account how they're feeling. It might not just be the type of drug they're taking, it could be how that makes them feel in that specific hour or 2 hours that we see them. Although it is traditional massage techniques, we need a lot more background knowledge when we're applying them than your general massage session. This is one of our first case studies that we're going to have a look at. And this is focused more on how the role of human touch can be very important when it comes to oncology care. It might not be what our actual aim is, as in what we're treating, but someone just receiving that human touch. One of my favourite evidence-based summaries, it comes from the Society of Integrative Oncology. They say massage therapy may be offered as part of supportive cancer care to improve anxiety, mood, and quality of life when appropriately adapted. We're not looking at whether someone's got tight hamstrings or not. We're improving their quality of life and enabling them to have a better ongoing outcome than just looking at the state of the soft tissue in front of us at that time. When is it appropriate to have oncology massage? We can have it can be during treatment if the appropriate adaptations are made. So sometimes we will visit clients while they're receiving live chemotherapy, and that can be on the hospital ward. Sometimes they come to us immediately after for treatment. But this one really does need some care, and we do need to communicate with the oncology team that they are receiving treatment from to make sure that we're not making any changes that is going to have a negative effect on the treatment and the drug that's being used. It can be after treatment. So it might be that a course of chemotherapy, radiotherapy has finished, and we come in to provide massage services then. Even someone who has had cancer treatment in the past, and historically it could be 15, 20 years ago, they may be receiving treatment for something completely unrelated. They would still need to see a massage therapist who has knowledge of oncology care, even though the specific issue is not related to cancer care at all. And then sometimes we do come into play when there is palliative and supportive care, making someone as comfortable as we can as they reach the end stages of their life. That brings us on to our second case study. Again, this slide's got a fair amount of information, but just as a summary, there is one patient who described finally being able to wear normal shoes again after years of neuropathy. The neuropathy was induced by the chemotherapy that they were receiving for cancer care. While this is only one case and we can't really generalise from it, it does highlight how supportive touch therapies can improve comfort and function even when they don't alter the underlying disease at all. We come back to the point we're looking to improve someone's quality of life. I'm sure you don't need me to tell you about the impact of cancer treatment on a person's life. However, these are a few things that clients have reported they feel they've benefited from when receiving massage treatment. These are the areas they feel have improved in their lives. And that's backed up by the quote from the Journal of Clinical Nursing, where they've noted that there is a significant improvement in pain, anxiety and quality of life when they receive massage treatment as part of their care. The next question to answer would be, once you've decided that you would like to try massage therapy, how do you choose a good therapist? Again, this slide's got a few questions that you can ask. There are a relatively small amount of massage therapists who have undertaken a good standard of oncology massage care training. At Livewell Health, we are working to change this, so hopefully in the very near future there will be a few more therapists around the country who are able to provide it. But it is very important to make sure that you get someone who is properly qualified. There are many studies that have gone on, and when a massage therapist has the correct qualifications, there has been very little negative effects shown. But I can't emphasise enough how important it is to make sure your therapist has undergone the correct treatment. And try asking these questions, and that should be able to narrow things down and get you in the hands of a competent therapist. This brings us on to our third case study. So specifically chemotherapy for ovarian cancer. One of the most important findings wasn't specifically dramatic symptom improvement. It was more that women could safely receive adaptive supported therapies alongside chemotherapy. So this is backing up what we've said previously. Massage therapy is safe as long as we make the correct adaptations and you've got a well-qualified therapist that you can go to, you can talk about your concerns, they can put you at ease and use the correct techniques in your treatment. One of the questions that we've been sent, and is one that I get a lot, not necessarily specifically for oncology care, but other types of surgery, knee replacement, hip replacements, etc., is how long after surgery can someone have a massage? It really varies on a case-by-case basis. So in some cases, I will get involved even before the surgery occurs. For example, if I have a client and I know they're about to have a knee replacement surgery, I tend to work on them for a few weeks before surgery and do what we call creating space. So it's making sure the soft tissue is in a good state to be operated on. And that tends to improve the outcome of the operation. It speeds up recovery time. Very similar with oncology care. It may be that if I'm on the scene, I will recommend to someone that we start working on the site before surgery. And then as soon as we get the go-ahead from the surgical team or the consultant who's checking the wound and the progress, we will go back into doing remedial work. Initially, that won't be directly on the scar itself. It is more likely to be that we work on the surrounding areas to make sure they're not taking on too much load from the area that currently needs to be protected. A little way down the line, and that can be as soon as 6 to 8 weeks, we start working on the scar tissue. The quicker we can get to work on scar tissue, the better it responds, and the less long-term effects come from having scar tissue in the body. Again, this is case by case. So for some people, they may need to wait longer. For some people, we might need to start treatment a little bit faster, depending on what the next stage of treatment is, depending on how each individual body responds to the operation that they've had. Another question that I get a lot of is, does massage risk moving cancer cells throughout the lymphatic system? Basically, if I have a massage, is it going to encourage cancer cells to move around the body and cause cancer to grow in different area? There is no research to support this. It is a little bit of an ongoing myth. What we do tend to do is avoid working directly on the area where there is a tumour if it is close to the surface of the body. But this is mostly because it is not particularly comfortable. There's normally a fair amount of inflammation and pain in that area, so it is better to avoid that area anyway, but it is not down to whether or not we're spreading cancer cells. It's a very complex process when a cell metastasizes, and massage has not been shown to have any effect on that process at all. Another one of the questions we've had sent in is, what is the difference between oncology massage and a regular massage? We've touched on this one already, so I won't spend too long on this, but it does have a basis in traditional massage. We do need to make a few adaptations. So we will take a full treatment history. We'll be looking at what type of medications. There are a few medications where massage is contraindicated, because the type of chemotherapy means that that person should not have skin-to-skin contact with anyone else. But those medications tend to be quite rare, and the client who's receiving it tends to be very, very aware that they're having it, in which case we would have to hold off treatment until that drug was completed. We will be adapting not just our overall treatment program, but also from a treatment basis. So I could see someone 1 week and they are able to take a higher pressure level or a longer session. The next week, because of the way their body is reacting, we may have to have a shorter session. It might not be as deep. They might not be comfortable laying on their front. There are a lot more adaptations that we need to make when it comes to someone who is undergoing oncology care. Another question is what the benefits are of having massage when undergoing oncology care. There's a list of a few of them on this slide. It's not that all of my clients report experiencing all of them, but these are the most frequent ones that people come back the next session and go, you know what, I slept so much better, or my fatigue levels were nowhere near as bad. It is very different from person to person. There is an interesting study that was done by the Memorial Sloan Kettering Cancer Centre. They delivered thousands of massage sessions to their clients. The main 4 improvements that they saw were anxiety, pain, fatigue, and emotional distress. It is looking like they're going to integrate that as part of their routine treatment. It's not that massage is just outside of medicine anymore. It's very much being recognised as something that should be integrated. Some of the world's leading cancer hospitals now integrate specially adapted oncology massage into patient care. It's not an unusual thing anymore. It is something that's becoming very widely recognised as having a very high value to clients who are undergoing care. Another question that we've been sent in is, what qualifications should someone look for? So as a baseline, you want a recognised massage qualification. That's before taking into account oncology training. They need to have a good base in massage therapy. Personally, I would prefer to go with someone who is qualified to a sports massage level. Sports massage, although it has sports in the name, is not just for athletes. A sports massage therapist has learned a lot more about the makeup of the soft tissue, how to treat it in varying different stages of injury. Gold standard will be you want a sports massage therapist who has achieved a level 5 qualification. That includes remedial therapy as well. So that is your baseline that you're looking for. On top of that, you want specialist oncology massage training. This should be training that is not just an online course. It should be quite an in-depth course with case studies, with hands-on technique. They should have done a fair amount of practice hours as well. So that is something that you can ask for. You can ask about what their massage qualification is, also where they studied for oncology massage. They should have a professional membership and they should have insurance. Now, your professional membership might be something like SMA, Sports Massage Association. It could be STA, which is the Sports Therapy Association. There are quite a few different ones out there. They're the two main ones I'd be looking out for. But if they provide you with the professional membership they're a part of, you can then go and look them up and have a look at what their standards are. Insurance should be public liability. They should be specifically insured for cancer care as well. They should have some evidence of continued professional development or CPD. So they should be up to date on techniques. If the last qualification they did was 5-10 years ago or more, they may not be up to date with what the techniques are now, and science and research is moving very fast and constantly changing. Possibly most importantly, on top of all this, is experience working with cancer patients and survivors. They may have worked with an oncology ward in a hospital. They may have worked with a hospice. They might just have experience in private care, but they should have some past experience, which they will have received as part of their training if they've gone to a good oncology massage training school. There are a few different things to look out for, and I know it can be very difficult to narrow down the field. There are a lot of courses out there that are advertised as oncology massage but don't give a high quality of training. So I really would emphasise, take your time in finding a good therapist, because it is well worth the effort once you get to the point of treatment. I really wish there was a register for specialists. Unfortunately, there isn't, and oncology massage is not a protected title here in Britain. So someone can use the title of oncology massage therapist without having a specific qualification, which makes it very important to ask them where they've qualified and what experience they have. You can look at certain directories. So oncology massage training schools tend to have their own directories of therapists in the country. And you can look at professional massage associations like the STA, like the SMA, and they have a directory that you can use. Oncology massage therapists tend to be quite few and far between. So there is a large number of massage therapists, a relatively small number of them trained to become oncology massage therapists. So just beware when you're looking. I would say avoid typing it straight into Google Maps or something like that. Go via the directories, go via the training schools, and that will be your best chance of finding a good therapist. As we come to the end of today's webinar, I'd like to leave you with one final thought. When someone is diagnosed with cancer, so much of the focus, quite rightly, becomes the disease itself. There's appointments, scans, blood tests, surgery, chemotherapy, medications, follow-ups. The priority becomes to treat the cancer, and modern medicine has made great advances in doing just that. Every member of your medical team is working towards the same goal, giving you the best possible outcome. But then alongside all of that, there's also another part of the journey that isn't always talked about enough, and I personally feel like it needs to be given a little bit more time. It's the journey of living in a body that's changed. A body that might feel different after surgery. It's a body that carries scars, stiffness, fatigue, or discomfort. It's a body that may have lost strength or confidence. A body that perhaps doesn't quite feel like your own anymore. For many people, the physical recovery doesn't end when treatment finishes. In fact, that's often when a different kind of recovery begins. Although the hospital appointments have become less frequent and friends and family, they might begin to think that life's returning to normal, but you're still navigating the physical and emotional impact of everything that you've been through. A lot of my clients tell me that they just feel grateful to be alive, but at the same time they don't feel like themselves. And those two feelings can exist together, and we shouldn't feel guilty for feeling those things. Recovery isn't just about surviving cancer, it's about learning to live well afterwards. As therapists, we're privileged to see the side of recovery that isn't always visible. We see maybe the female client who's nervous about lying on a treatment couch because she's worried someone might touch her scar. We see the person who apologises because they can't lie comfortably on their back. We meet people who've become so used to pain or tightness that they've stopped talking about it. They assume it's just something that they have to live with. That might be the most rewarding part of my work. It's when we help someone, although it's not helping someone to move freely, that is a great thing to be able to do. It's not reducing muscular tension or improving scar mobility. These are all things that can be quantified, put into your medical notes. They can make a real difference to daily life. But watching someone gradually begin to trust their body again, that is massive. Because cancer and cancer treatment does change our relationship with our bodies. For months, sometimes years, your body may have been the focus of medical treatment. It's been scanned, examined, operated on, injected, monitored and measured. Every touch has had a medical purpose. Therapeutic massage, it offers something very different. It's a touch that doesn't come with a side of fear. It's a touch that doesn't come with IVs or needles. It's not an examination. It's touch that is centred around comfort, well-being, and supporting you as a whole person, holistically. One of the comments I hear most often from clients isn't, I feel like my problem's gone. It tends to be more things like, I finally relaxed. Or they'll come in after a treatment and go, you know what, I slept through the night for the first time in weeks. Or I didn't realise how tense I'd become until some of it was taken away. And possibly my favourite one, I feel like I've got my body back. Those are very important moments. You might not see their effects on a blood test or a scan report, but they matter a lot because quality of life matters. Being able to go out and walk the dog without discomfort, being able to play with children, grandchildren, go back to gardening, enjoying a holiday or get a good night's sleep, feeling less anxious before an appointment. And research is increasingly recognising this. Studies consistently show that when massage is appropriately adapted, it can help to reduce anxiety, improve relaxation, reduce the perception of pain, improve sleep, and enhance the overall quality of life for many people affected by cancer. Although massage is never a treatment for cancer itself, and I would never suggest that it is, it can be a valuable part of supportive care. It helps people to feel more comfortable, more connected with their bodies, and able to cope with the challenges of treatment and recovery. And it is a challenge. Hopefully today we've dispelled one of the most common myths surrounding massage and cancer, that massage somehow spreads cancer through the body. Research has now shown us that this simply isn't supported by modern cancer biology. Cancer spreads because of complex biological processes within the cancer itself, not because of therapeutic touch that has been adapted and applied by a skilled therapist. The important message isn't to avoid massage, it's to make sure that it's delivered safely. It should be delivered in a thoughtful way and with someone who has the appropriate oncology training. There is one message I'd like you to take away today. You should never feel like you simply have to put up with the physical effects of treatment. It could be scar tightness, it could be restricted movement, it could be muscular pain, persistent tension, fatigue, changes in your posture, or the feeling of being disconnected from your own body. These are all things that deserve to be acknowledged, and in many cases they can be supported. You don't have to struggle in silence because you think these symptoms are just the price of surviving cancer. Please go away and ask questions. Speak to your clinical team. Get advice from qualified professionals. If you choose to have massage, choose someone who has got the right level of training, someone who's going to take time to understand your history, your treatment, your concerns, your goals. Good oncology massage is never ever a one-size-fits-all. It's personalised, it's collaborative, you need to work within the oncology care team, and it is centred at the very middle of it. It's all about your needs. It's also important to remember that everyone's journey is very different. Some people who are watching today might be newly diagnosed. Some might be undergoing treatment. Some might have reoccurring disease. It may be many, many years beyond original diagnosis. Some days will feel hopeful. Other days may well feel very overwhelming. There are no rules and there is no right or wrong way to experience cancer. And there is no set timetable for recovery. Whatever stage you're at, I hope today's webinar has reassured you that looking after your well-being isn't a luxury. It is very much an important part of your care. Accepting support definitely isn't a sign of weakness. It's part of giving yourself the best opportunity to recover, adapt, and to continue living life as fully as you possibly can. Before I finish up, I'd like to say thank you to Overcome for inviting me to be part of this webinar. And also thank you to each of you for giving me your time today. I know time is very, very precious, and I hope that you come away at the end feeling a little bit more informed, hopefully more confident, and perhaps might think about massage rehabilitation as part of your care. I think the thing that sums things up is the sentence on this slide. Cancer treatment is about treating the disease. Rehabilitation, including massage care, is about treating the person, and you deserve both. It's not one or the other, you do deserve to have both. Thank you very much for listening. I wish you all the very best for whatever stage of journey your life is at, and I hope you continue to treat yourselves with the same kindness, patience and compassion that you offer to all the people around you.